Troubleshooting Series, Clinical Follow-ups and Case Monitoring. Welcome to the second video in our series of troubleshooting modules. In this video, we will discuss the following points: how to plan clinical follow-up visits for your patients, place aligner cuts and cutouts for elastics use, and finally, aligner tracking and case monitoring. Planning follow-up visits. As we know, one of the biggest advantages of clear aligners over fixed appliances is that fewer clinical visits are needed. But of course, that does not mean that clear aligners do not need any follow-up visits. On the contrary, clinical visits are essential in ensuring patient compliance, case tracking, and that the required procedures are performed during the treatment. During clear aligner treatments, follow-up visits are needed for the following: to perform IPR before certain steps, place attachments, place cuts or buttons for elastics use, and finally, for continuous monitoring and progress evaluation of the case. IPR, or interproximal reduction, should be planned and performed precisely with clear aligners treatment, as many of the planned movements will depend on the provision of space by IPR before that particular step. That is why it is recommended to check your case IPR details in the Applied Treatment section on Eon Access and plan the IPR visits accordingly. For example, this case needs interproximal reduction before step 1, 10, and 19. Let's say the patient is on a 1-week wear cycle. Then we need to plan follow-up visits after the 9th and 18th weeks. It is also wise to inform your patients in advance about these follow-up visits and educate them about their importance to improve compliance. Attachment placement is usually planned by default before step 1 with most of Eon cases. However, this is a clinical preference, and some clinicians may choose to use passive aligners in step 1 to give the patient some time to adapt to aligner wear. Sometimes, accessing certain teeth for attachment placement might be impossible and may even cause severe interferences with the opposing arch. In such cases, attachment placement on that specific tooth can be delayed to a later step until better accessibility is achieved. That's why it's important to check the placement of the attachments on the treatment setup and applied treatment section on Eon Access. This will help you deliver the aligners and plan the patient's visits accordingly. Elastics are valuable in clear aligner treatments as they support complex teeth movements and provide anchorage. Moreover, they increase the predictability of achieving difficult movements, as explained in previous modules. Elastics wear can be planned before step 1 or in later steps, depending on the teeth movements. You should check the elastics module on Eon Access and plan the patient's follow-up visits as per the timing of elastics use. This is crucial in planning the placement of buttons or checking for the presence of cuts and cutouts in the aligner steps. As mentioned earlier, although the use of aligners has significantly reduced the need for regular appointments, continuous checkups, and case monitoring are still recommended. The accepted frequency for scheduling follow-up visits is every 6 to 8 weeks. However, the frequency can be increased or decreased per each case's needs. Moving forward to aligner cuts for elastics use. As discussed, elastics can be used either from step 1 or in later treatment steps, depending on the planned movements. All the details you need to know regarding the planned elastics will be available in the Applied Treatment section on Eon Access. For example, in this case, Class 2 elastics are planned, with precision cuts on upper right 3 and a cutout for button placement on the lower right 6. First of all, go ahead and check the aligners for the presence of cuts. In case any of the aligner steps do not have the cuts as planned, you can simply place the cuts at your clinic. You can either use sharp scissors or a blade to make the cuts, as shown here. Check the aligner fit over the teeth and mark the areas requiring the cuts while the aligner is still on. Remove the aligner and proceed with the cutting process. Be sure to put the aligner back on and check again. Another scenario you may encounter is when cutouts are present but are too small in size to fit the buttons. You may also encounter a precision cut that is shallow or not retentive enough for the elastics to catch onto. In this case, there is no need to request a replacement aligner from Eon. You can simply adjust the size of the cuts on the aligner. For example, in this case, you can mark the shape and size of the cutout and proceed with cutting using a scissor or blade. Notice how the button is fitting properly in place now. For the precision cut too, you can use a scissor or blade to increase the size of the cut and try the elastics again. Notice how it resulted in better attachment of the elastic now. Moving on to aligners tracking and case monitoring. It is important to check the fit of the aligner on the patient's teeth during each follow-up visit and educate the patient on how to differentiate between a good-fitting aligner and a poorly fitting one. A good-fitting aligner fits tightly on all the teeth, with no gaps between the aligner and the incisal or occlusal edges of the teeth, as shown here. This is an indication that the movements are tracking as planned. On the other hand, a poor-fitting aligner has gaps between the aligner and the incisal and/or occlusal edges of teeth, as we see here. This could indicate a lack of tracking for one or several teeth, and action should be taken to address the issue using your clinical judgment. For more details about how to diagnose and resolve lack of tracking issues, please refer to the Case Monitoring, Case Progress, and Troubleshooting module in the catalog Beyond the Basics. Thank you for watching.